Welcome to our today's talk. And our today's talk is going to be on the complications of diabetes mellitus. What do we mean when we say complication? So complication simply refers to the outcome of what happens when the blood glucose or blood sugar levels are not properly controlled. And that is what we want to have a look at today. So let's get into it. The complications of diabetes mellitus are broadly classified into two major classes. And the first class is called acute complications. Acute means very sharp but very sudden. It's of sudden onset, which rises very rapidly and steadily. The second class is called chronic complication, and chronic means very slowly over a longer period of time. So in summary, the complications of diabetes mellitus are classified into two major classes, and that is acute complications and chronic complications. So let's start with the first one, which is the acute complication of diabetes mellitus. So under acute, we also have three major complications that are very common when it comes to diabetes. The first one is called diabetic ketoacidosis, which is commonly referred to as the DKA. The second one is called hyperosmolar hyperglycemic non-ketotic state. And this is very common, especially in type 2. The DKA is very common in type 1 diabetes mellitus. The next acute complication is called hypoglycemia. So instead, the blood sugar levels fall below the normal. And in this case, it falls below 2.2 millimoles per liter. That is called hypoglycemia. And that is also a complication of diabetes mellitus. The next classification is on the chronic class, or the chronic complications of diabetes mellitus. Which ones are they? So we also have two major classifications or sub-classifications of chronic complications of diabetes mellitus, and they include, number one, we have those complications of the larger vessels, what we call macrovascular complications. Macro refers to or means larger or bigger. So those complications that affect the bigger vessels or larger vessels. And they include the following: one, the coronary artery disease or the coronary heart diseases. Number two, arrhythmias or irregular heartbeats or irregular heart rates. The next one is hypertension. In this case, it's more of secondary type of hypertension. Our next macrovascular complication is called the cerebrovascular accident, commonly referred to as CVA or stroke. The next complication falling under macrovascular is called cardiomyopathy. Those are diseases of the heart that can occur when one's blood sugar is not properly controlled. Now let's move to the next subclass of chronic, which is the microvascular complication, and micro refers to smaller. So those complications that occur in smaller vessels, and they include the following: one, visual impairment, and this occurs as a result of what we call diabetic retinopathy. The next microvascular complication is that of the kidney, so that we have the kidney failure. and in this case what we call the diabetic nephropathy. The other complication is on the damage on the neurons, or what we call the nerves, so that we have numbness of extremities. We have diabetic foot, and this comes as a result of what we call diabetic neuropathy. Now, ladies and gentlemen, those are just but a few examples of various complications of diabetes in case the blood sugars are not properly controlled. In order to avoid the above that I've highlighted, kindly make sure that your blood sugar is in control. And this can only take place if you follow your doctor's prescription and follow your clinics, and you take your meds or medication at the right time. Keep checking on your blood sugar levels to make sure that they are properly in control. If you are watching us for the very first time, kindly subscribe. Until next time, it's goodbye from all of us.